So hello everyone and welcome again to this session. So I'm Dr. Ankit, your anatomy faculty over here in our Oracle platform, and today we are going to continue our head and neck series. So it's a 45 days MBBS final intensive revision series that is going on, and the topics that we are covering right now are the head and neck topics, particularly the neck region. So in the previous session we talked about the deep cervical fascia and the posterior triangle, and today we'll be mainly talking about other topics like anterior triangle and all that we'll see subsequently right now. So it's a intensive revision series, and these are rapid revision of all the important questions. You have volatile facts, you have high yield topics, you have most expected topics, and it is beneficial not just for the university exam students which are who are mainly preparing for the university, but also for our NEET PG and FMG exams as well. Right. So these are our main topics that we are going to cover up today. The main topics are anterior triangle of the neck. It's a huge topic. There are many triangles which are present inside the anterior triangle, so it has many of the subdivisions that you'll see. And next we have a region known as parotid region. Parotid region, we all know the largest salivary gland, parotid gland is located in this region. So we'll talk. These are the two main topics that we are going to discuss today. And through these two topics, you have long essay questions, which usually come in the previous year questions. You have a short essay questions, you have also short answer questions. Here, if you look at all the questions in the end, they're also showing us that in which year and which exams they have been asked. Okay, so it is all research-based discussion over here that is going on. So it's basically previous year questions. For example, a long question came around the parotid gland under the following. They're asking that describe the parotid gland under the following headings, like surface border relations, duct, and all that. Similarly, they asked about the digastric triangle, short question. Also about the facial artery, that will read detail in the face part. They can even ask about the parotid duct, about the other parts of the anterior triangle, and very importantly, ansa cervicalis. Now, let me tell you over here that one thing is university exam that we are obviously mainly focusing on, but remember, as I've been teaching through many years for our NEET PG and FMG students, these are the topics only from where the questions, the MCQs come in our NEET PG and our FMG exams, right? For example, recently question came from the parotid duct, then recently question came from the facial artery as well, and obviously triangles, their boundaries, their content, a lot of questions, right? So these are things that we are going to discuss. Why to choose Oracle? You have all these features like recorded classes, live classes, practical sessions, exam modules, and as well as hard copy book sets. These are all these subpoints over here are the best in the business over here, right? So best in the market which you will get. These are one of those. Like hard copy book sets, beautifully crafted notes over here. Exam modules are beautifully crafted. You have recorded as well as live. Let's see the benefits. So in recorded classes, obviously the main benefit that the students usually tell is that they have a flexibility of learning. Like many students, they are busy in their classes or some projects. Or for those who are preparing the competitive exams, they are busy doing some job or anything like that. So mainly is flexibility. Then you expert instruction and convenient revision as well. Live classes, the main benefit is if you are lucky enough so that the classes are aligned to your free period, free time where you normally study. You have in-depth coverage, you have interactive learning over here. This is the main point which we normally feel in our live classes. Where the students can directly ask live in the class, right? Then express exam module we have, you can see all this complete syllabus in around 20 hours. So it is a sort of rapid revision, we can say, right? It's beneficial mainly for those students who have a base, a knowledge, a base of knowledge over there, right? So they have good basic knowledge, and then this rapid revision will help. Doubt clearing session, again, a very important component of our this Oracle classes. And hard copy note set, as I already told, and I've seen those hard copy notes as well. Here, the main feature is that all the notes which you will see are in the form of question and answers, right? So you get a good picture of the theory exams as well as the Viva exams. Secondly, a lot of beautifully crafted images are there. There are fun zones are over there. There are MCQs over there. There are discussions over here. Yes, one of the best notes that you will get in the market, right? Do remember that. Question bank we have only, so we already discussed that question bank we have in that. Now, the main use of the question is basically it's for your self-assessment. You assess yourself that whatever topic you have learned, you know it well or not. Because learning is one thing and understanding it and learning and remembering it for a longer time is other thing, right? Suppose you learn anything today, but after say 15-20 days, you know nothing about it, or you only know 10% about that topic, then what's the use of reading, right? So therefore, these question banks, this self-assessment, therefore, we always, every educator, every faculty always keep on telling you the use of revision, right? So this question bank are sort of tool in your revision, and it helps you assess that, okay, you have learned a topic a month back, you again need to revise it. Okay, that's a alarm call. Practical sessions also, they are very, very important in a course like MBBS, and particularly in our subject like anatomy over here. You know, here madam is holding out a skull and showing us the skull foramens and all. So these are much needed. And anatomy as a subject, you all know that it's best understood when we look at the images, when we do the practicals, when we look at the bones and all that. So these are also there in Oracle. 3 subscription plans are there, from basic plan to standard plan to a premium plan, with the ranging from around 19,999 to 34,999 to 5,999, right? We have this 3 plans over here. Different features of all these plans. And remember, for the subscription plans, you can use the code also written in the bottom line. As you can see, the code is Dr. ANKIT. That's my name, Dr. Ankit 20. So you can get some exciting and discounts on the subscription plans. Okay. So do remember this. Let's come back to the topics that we are going to discuss. For those who joined a minute late, these are the 2 main topics that we are going to discuss. These are huge topics: anterior triangle of neck and parotid region. We'll try to divide half of time to each one of them, right? Okay, so without wasting any further time, let's jump straight away to our topic over here. And here's the topic, right? So let's begin over here. Begin with the anterior triangle of the neck. Anterior triangle of the neck. So yesterday we discussed about the posterior triangle. Let me show an image over here. There's an image. Okay, and just a second. Just yes, this is the image over here. Now look at this image. Look at this image. Here, this is the anterior aspect. Obviously, this is the posterior aspect. Okay, we are looking at a region of the neck. There are many landmarks which you are seeing over here, but let me tell you, there here in this diagram you are seeing 4 main muscles. How many main muscles? 4. So we are looking at 4 main muscles, and out of this 4 main muscle, the most important muscle, which actually divides this whole region into 2 triangles, is sternocleidomastoid. Sternocleido means clavicle, going to mastoid, mastoid. So this is the muscle over here. This I'm making some cross hatch lines with the red color. This is the sternocleidomastoid. Okay, so this divides the entire neck into an anterior triangle over here and a posterior triangle over here. So anterior to the sternocleidomastoid, if I may highlight with this green color, this whole region is the anterior triangle, and this different color over here behind the sternocleidomastoid, this is the posterior triangle. As simple as that. The single most important muscle is sternocleidomastoid. The second muscle which you have seen in the previous session also we discussed is the trapezius. So this is the trapezius over here. I'm writing TPZ. Here also it is written trapezius. So these 2 muscles, sternocleidomastoid and trapezius, between them you have this posterior triangle. Which triangle? Posterior triangle. This we have done in the previous session. I'm sure you must have listened or heard or seen about it, right? Now, there are 2 other muscles over here. Let me first write their names. One is the muscle known as digastric, which has 2 bellies, anterior and a posterior belly. And one muscle over here is the omohyoid muscle. Omohyoid muscle. Let me first show you the muscles, then we'll see about them. This black color which I'm marking now, this is the anterior belly, and it moves back. This is the posterior belly. So which muscle is this? This is the D.G. digastric muscle. Okay, digastric. Di means 2, gastric means belly, gastric, stomach, belly. So digastric muscle name came from having 2 bellies. So this lying anterior is the anterior belly, this lying posterior is the posterior belly. So it has 2 bellies. Simple as that. The 4th muscle which I have written over here is omohyoid. Let me show you the omohyoid over here. This is this purple colored mark which I'm making is the superior belly of omohyoid, and this one going posterior in the posterior triangle is the inferior belly of omohyoid. So let us write their names. This over here is the SBOH, superior belly of omohyoid, and this over here is the IBOH, inferior belly of omohyoid. In the previous session, we discussed that this inferior belly of omohyoid divides the posterior triangle into an occipital and a subclavian triangle. okay, or supraclavicular. We have discussed previous session. So here you have four muscles: SCM, trapezius, digastric, and omohyoid. Clear? Posterior triangle we have done previous session. Now we are focusing into anterior triangle. I'm just showing you the images. Anatomy is best understood by looking at the images, or if you can feel on your own body. So you get a bigger picture of the area or the structure which you are learning or about to learn. Okay. And after understanding this, then we can go to the theory. So if I show you my neck over here, if I rotate my head to the right side, this is my sternocleidomastoid. So this whole area is my anterior triangle, right? This whole area is my anterior triangle. In this anterior triangle, I have a muscle. If you can imagine, this is the digastric muscle, anterior belly and posterior belly. I repeat again, anterior belly, posterior belly. It is deep inside. And there's another muscle which is superior belly of omohyoid, which is going into the shoulder. Now, the word meaning is very important. Here you can understand hyoid. It means that this omohyoid muscle has to have a connection with the hyoid one, which is over here. So hyoid is fine. What is omo? Omo, medical science, it means the region of shoulder. Shoulder is this region. You can see the muscle is going from hyoid to shoulder. In shoulder is attached to which bone? It is attached to scapula bone. Okay. That is our omohyoid, having a superior belly and an inferior belly. One lying superior and one lying to the inferior side. Okay. This whole picture. Now focus only on this green highlighted area. And here, if I zoom it a bit more, to let you understand more, here you can see that this triangle, I'm making some dots. Okay. So let us start, say, some red dots over here. This red dot area, which is between the anterior and the posterior belly of digastric. Can you see the black color digastric muscle? So this area, let's see on my own neck. This was the anterior belly. This was the posterior belly. So this anterior belly, posterior belly, and then this base of the mandible, plus the area of between the angle and the mastoid. This whole area is my digastric triangle. Digastric triangle is also known as, it is, okay, tell me, it is this triangle digastric. You can see the image as well. Is it below the mandible or above the mandible? Is it this triangle? Is it below the mandible or this triangle is above? You will definitely say, sir, it is above. It is below the mandible. Therefore, digastric triangle is also known as submandibular triangle. What it is known as? Submandibular triangle. It's a other name of digastric triangle. Okay, one triangle is this. Let's see another triangle. Now, can you see this triangle over here, which I am now putting some dots? Okay. Or if I make some black cross hedged lines over here, here you can feel the carotid pulsation. Previous session we discussed about a sheath known as carotid sheath, which had common carotid or internal carotid artery. Remember, where do we palpate it? We palpate it on the side of the neck over here. So this triangle is known as carotid triangle because one of the important contents of this triangle will be the carotid sheath. Therefore, this is your carotid triangle. Let me just put an arrow over here and write CAROTID, carotid triangle. Okay. Now, there are four triangles. We have done two. Two are more are left. Fourth one is the most small triangle. We'll do it in the end. Now, another triangle over here, which I'm marking with say blue color over here, right? It is not exactly a triangle, but this area is located in the front of the neck, right over here. This area is having a very important content, which is known as your thyroid gland, right? So here we have thyroid gland. Okay, so you have the muscle like, see over here, you have the anterior belly of digastric, then you have the superior belly of omohyoid. Okay, so below anterior belly of digastric and in front of superior belly of omohyoid, and you have this median plane over here. This area, this on both sides, right and left. This is known as your muscular triangle. Which triangle? So are there any big muscles over here? Is it very muscular? No. It's not very muscular, but it does have some muscles. And these muscles are known as your strap muscles. What are they known as? They are known as strap muscles. I'm writing over here STRAP, strap muscles. These muscles are actually longitudinal muscles, thin muscles, which are covering the front of the neck. Like for example, sternohyoid muscle, sternothyroid muscle, all these are strap muscles. Therefore, this triangle or this area in the anterior triangle is known as a muscular triangle. That was our third triangle. So for one is our digastric triangle, two is carotid triangle, and three is muscular triangle. Done. Let us revise this. This is the most important part. See, nodes, boundaries. Once you understood the diagram, you will easily make it. First of all, for the initial 5-10 minutes, understand. Anterior belly digastric, posterior belly digastric, base of mandible. So which triangle is this? Digastric or submandibular, right? Now, another muscle is superior belly of omohyoid, and this muscle is sternocleidomastoid. So now look at the carotid triangle. First, look in the image at carotid triangle. Now look at my neck. Posterior belly of digastric, superior belly omohyoid, sternocleidomastoid. Which triangle? Here you can feel the carotid pulsation, carotid triangle. Okay. Then now look at the diagram. Understand the muscular triangle. Understand its boundaries. Then see anterior belly digastric, superior belly omohyoid, lower part or anterior border of the lower part of sternocleidomastoid, and this anterior medial plane. This whole area, which triangle? Muscular triangle. So this whole area is our muscular triangle. Okay. Got the point now? Fourth triangle over here is known as submental triangle. What is that? See, if I extend my neck like this, you can imagine this is my symphysis mentae, and deep to the symphysis mentae, I have the digastric muscle coming out. So I have anterior belly of digastric of left side, then I have anterior belly of digastric of right side. And where are they both going? To the hyoid bone. Okay, the bone over here is hyoid bone. Remember, it is above the thyroid cartilage. So I have anterior belly of digastric of the left side, I have anterior belly of digastric of the right side. And then I have the hyoid. You can understand this triangle over here. That is the triangle which is below the mental protuberance. So that is your fourth triangle over here, which will be located right over here. Fourth triangle. I'll show another image. That is known as submental triangle. It is below the mental protuberance. Okay. I hope this point is clear. The more you revise it, the better you'll understand. This image over here, just to show you that. Now, for those who might not be very comfortable with this image understanding, let me show you another image over here, similar to, and here it is, right over here. Now, looking at this image, some of you might feel a bit confused from where it is taken. Look at this image and look at the camera and try to understand. If I extend my neck like this, and you guys focus where? Focus on the mandible. Okay. Focus on the digastric muscles, anterior belly, posterior belly. Focus on the omohyoid muscle. Okay. So superior belly omohyoid. Focus on the sternocleidomastoid muscle. So this diagram over here, let me write over here, is an image showing the extended neck. It is showing us the extended neck. And basically, we are looking over here at the anterior triangle of the neck. What are we looking at? Basically, we are looking at the anterior triangle of the neck. Okay. Now, in this image, let me put some highlighting over here. And you guys have to find out. Okay, think which triangle is this? Green highlighted area on both the sides. You can look at the labeling also, but to be honest, if you are true enough for yourself, don't look at the labeling. Try to answer this. This triangle is between the two belly of digastrics over here. So you have the two belly of digastrics and you have the base of mandible. This is our submandibular or the digastric triangle. So I'm writing D over. Okay, now another highlighter. Try to identify this triangle if you can without looking at the labeling. Just a second. Yeah. Okay, right over here, right? So you can see which muscles are over here. Posterior belly of digastric, superior belly of omohyoid, and what is this line? This is basically line representing the sternocleidomastoid. So we have which triangle over here? We have the carotid triangle over here as already written. So here you feel the carotid pulsations over here. Then third highlighted triangle over here. Let me change the color to bit different color over here. This over here, yellow color. This is the area which is lying in front of the trachea and obviously the thyroid gland. This triangle has some strap muscles known as muscular triangle. Okay, so we have submandibular, we have carotid, we have muscular. You can understand the boundaries. Muscular triangle is having the superior belly omohyoid, sternocleidomastoid, and also a bit of hyoid bone over here. They are making the muscular triangle. Finally, the fourth triangle, which I said in the last, that I will tell you in the last over here, is this triangle. Okay, you can very well understand which triangle is this. This triangle is between the two anterior belly of digastric. These are the two boundaries, and one boundary is hyoid bone. Which triangle is this? This is our submental triangle. So this triangle over here is SUB, submental triangle. I hope the point is clear. Okay, understand this. Now, let me tell you one PG level question over here. One PG level question which I'm not sure has come or not, but can come very easily. They can give you a question like which of the following triangles is unpaired? Is unpaired. Options are these four only. Okay, options are your digastric triangle, your submental triangle, your carotid triangle, and your muscular triangle. Okay, just I'm writing in a bit hurry over here. So 1, 2, 3, 4. You understood three parts. So which triangle is unpaired? You can see carotid triangle. We have one carotid over here, one carotid over here, two triangles. Muscular also one over here, one over here. Submandibular or digastric also one. Submental one is the one which is it is unpaired. It is single. It is single and unpaired. I hope you got the point. This can come as a question. I'm just telling you about. Okay, so now we have understood the location of all the triangles. Let us see now the notes. Now, what is left? What as an examiner, as a medico, what you need to know is one, first of all, if the patient comes to you with any problem in the neck, you should identify which triangle is the main problem. Second, once you identify the triangle, if you are doing a surgery, you are opening the area, you should know that which muscle forming the boundaries of which triangle, so that you know the landmarks. The third thing is that once you open up this area, or even if you're not opening up, you should know that what are the contents of the triangle. For example, I told the carotid sheath is in the carotid triangle, fine. But is that the only structure? No, there are others, right? So you should know. Okay, you should know. I'm telling you what you should know. Don't always focus on what the question will come. Fine, questions will come from the main topics. So you should know the contents of the triangle. You should know the boundaries. Already I have shown you enough. Okay, other thing you should know the contents of the triangle. Okay. Now let us come to it. So here we have the anterior triangle of the neck. Now comes the notes and theory part. Let us go through them. So anterior triangle of the neck, whole anterior triangle. If you imagine the anterior triangle, what are the boundaries? Medially, you have the medial plane of the neck. This is the medial boundary. Okay, or if you see the camera over here, and you look at my image over here on the left side of my neck, this is my left anterior triangle. So this medially, what is that? Medial plane of the neck. Laterally is what? You have the sternocleidomastoid. And what is lying above is the base of the mandible, line joining the angle of mandible to the mastoid process. Okay. Now subdivisions you already have seen. There are four triangles over here. There are four triangles. We already have no but in detail right now. Let us see now their boundaries and contents. Focus over here, contents. Boundaries are how will we remember the boundaries? Guys, you don't have to remember the boundaries. If you can practice making the triangle, you will never forget the boundary. So how to make the triangles or how to draw the triangles is not a rocket science. It's very simple. Let me show you how. Again, remember that image of extended neck. Which image, sir? Here, this image. This image you can easily draw. It's not difficult. How? Let us see. This you can directly make the base of the mandible. From the top here, you can make two mastoid process. Okay. Then in the midline, you can make this median plane. Right? Median plane. And here you can make two bones. One is the hyoid bone over here. And one is you can start over here being the sternum down going down. Okay. So bony part over. Now muscle part. Muscle part is what? Start with the sternocleidomastoid. Main muscle is this. Which muscle? One muscle is sternocleidomastoid. Okay. Totally there are four muscles. Okay. If we include all the triangles, let us include the posterior triangle as well. For that, we can make the clavicle also. Let us make the clavicle also. So one muscle, first muscle is sternocleidomastoid. Done. Done. Second muscle going over here is trapezius. So this is trapezius. Which muscle? Second muscle. Then third muscle over here is coming from here. What is this? This is digastric muscle. So which muscle is this? Digastric muscle. Third muscle. Done. Done. Let us make it on both the sides, digastric muscle. Fourth muscle, let us change the color a bit, is your omohyoid muscle. So this is the superior belly of omohyoid, that is the inferior belly of omohyoid. So superior belly omohyoid and inferior belly of omohyoid. So this is the fourth muscle, omohyoid. Muscle number 4. How much time will it take for you to draw if you have practiced it? Let me be honest, hardly 10 to 15 seconds is all. Now here you can make all the triangles. Like for example, number 1 triangle, submental. Number 2 triangle is digastric or submandibular. Number 3 triangle is carotid triangle. Number 4 triangle is muscular triangle. Number 5 triangle is upper part of occipital, that is the upper part of posterior is the occipital triangle. Number 5 is occipital. And number 5 on both the sides occipital. Number 6 is your subclavian triangle on both the sides. So you can make all the triangles. How to start it? Start with making 2-3 bones like the mandible over here, hyoid bone, and below you can make sternum with clavicle. Simple. Then you know you have 4 muscles. 4 muscles are already I'm highlighting right now: sternocleidomastoid, trapezius, digastric, and omohyoid. Done. That's all. And once you have made this, now you know the boundaries of any triangle. Okay, now you know the boundaries of any triangle. You just have to practice this for 4 or 5 times. That's it. Now let's come down. Now we have done the hard work. Right, we have done the hard work of understanding and the understanding boundaries. Now let us quickly look at the contents, and our topic is over. Right, let us see. So starting with this submental triangle over here. The boundaries, you know what are the boundaries. Again, without looking over here, you should know, okay, antibelly of digastric and hyoid bone should be the boundary. Here it is. Contents, you have submental lymph nodes over here. Now, what is the clinically applied, which I may tell you over here? If there is a malignancy in the lower lip, tip of tongue, and the chin area, this area drains into the submental lymph nodes. So you should know that the tip of tongue part, okay, the lower lip part, they drain into the submental lymph nodes, which then drain into submandibular lymph nodes. Okay, but you should know this. Right, let us move on. Second is the digastric triangle, that is our submandibular. So boundaries are anterior, posterior digastric, base of mandible, and the line joining the angle to the mastoid. Right, so these are all the boundaries. What are the contents of this digastric triangle? Now, this digastric is a huge triangle. How to understand the content? Try to palpate this area. You'll see, yeah, there are a lot of structures inside. Some structures I can feel there is some soft structure inside. But is it tongue? Tongue is separate. Now open your mouth and feel the tongue. You will say, no, sir, tongue is different. Tongue is inside the oral cavity, but here we have some different structures. Let us see. You have some mandibular salivary gland over here, superficial part. Then you have facial vein, you have some arteries, nerves also lying over there. On this nerves over here, mylohyoid nerve and all, they are supplying the mylohyoid muscle, which is forming the floor of this triangle that we will see. Now the roof of this triangle, which triangle? Again, digastric roof. Yesterday we studied about the investing layer, right? So you will have that part of the fascia as well. So your skin, fascia, platysma, and all this part, this deep fascia is basically your investing layer of deep cervical fascia. Again, the contents, this was the what we have done till now is the anterior part of the triangle. Now, if you're looking at the posterior part of the triangle, that is behind over here, the contents are a bit different. We have the lower part of parotid gland, your external carotid artery over here is entering into the parotid gland. The parotid gland is the next topic, so we'll see over there. Floor meaning by that, if you are looking at understand, imagine you are looking at a patient, okay, who's came for you for surgery. When you cut the skin and fascia, these are all roof. When you see the contents like submandibular gland, vessels, nerves, veins, and all that, and once you remove them, then you look at the floor. Floor lies most deep. So you have muscles like mylohyoid and hyoglossus. This is not hypoglossus. This is hyo, H-Y-O, hyoglossus, right? H-Y-O-G-O-G-L-O-S-S-U-S. This is hyoglossus muscle. These are present deep inside, right? Similarly, you have the deeper structures which will be forming the contents. Mainly, what are these? These are some muscles, some nerves over here, and also a part of the parotid gland. Okay, but remember the floor muscles are important, and submandibular gland, some vessels and nerve over here are important for you to know. Clinical important. See, every structure will be given over here, but at this stage, what structures you need to remember are more important. Okay, so at least remember that. Now comes another triangle, that is the carotid triangle. Now, if you forget about the boundaries written in the notes, try to identify yourself. What, where is the carotid triangle? This is our carotid triangle. Okay, this is our carotid triangle. So what will be the boundaries of the carotid triangle? You have over here the posterior belly of digastric, you have the sternocleidomastoid and superior belly omohyoid. So you have posterior belly, digastric, okay, superior, some writing mistake over here, superior belly of, this is omohyoid muscle, and anterior border of the upper part of sternocleidomastoid. Then again, you know, this is the main content will be the carotid sheath. So you have the structures in the carotid sheath as the main content of the carotid triangle. Roof, again, we have skin, fascia, platysma, and some branches, nerve over here. Just go through them 2-3 times. You'll come to know over here, right? Floor again, now here again, important is floor. Like in digastric triangle, the floor was formed by mylohyoid and hyoglossus muscle. Here the floor is basically by the constrictors of pharynx. The constrictors of pharynx. What are constrictors of pharynx? Don't worry, these are simply sort of circular muscles in the pharynx, which when they contract, they constrict, meaning by they decrease the lumen of the pharynx so that the food can go down. Simple as that. So that will do in detail when we talk of the topic of pharynx. Okay. They basically constitute the pharynx as the floor. So remember, the floor is the one which is more important and frequently asked. Okay, so you have roof, you have floor, you have boundaries. Main content, remember, is the carotid sheath. And with the carotid sheath, see, there will be a lot of nerves over here. So just remember them or read them 2-3 times. They will come to you. You'll remember them. Last one is the muscular triangle. Muscular triangle, you already have seen that it's lying over there. So boundaries again will be what? Superior belly omohyoid. Okay, this is superior belly omohyoid. And this will be the sternocleidomastoid. Here is the median plane. So you have what? Superior belly, sternocleidomastoid, and here you have median plane over here, right? So main content is what I told you. You have strap muscles. So these are the strap muscles: sternohyoid, sternothyroid, thyrohyoid, omohyoid. See, omohyoid again over here being a content also, and also a form of the, you know, it also forms the our what we say the boundary, superior value of omohyoid. Oh, again over here digastric. It is written, it is omohyoid. So I hope you understood the diagram we have talked about earlier also, right? So these are some of the important. So what is important in triangle? See, we are finishing off this topic over here. Diagrams is important. Understand where do they lie. Most important. Then roof and floor, and between them you have the contents. That's it. Roof and floor, between them you have the contents. Roof is mostly common to most of the triangles because you have skin, fascia, platysma, and some superficial nerves, veins. So that will be in the roof. Floor might be somewhat different. Somewhere you have mylohyoid, somewhere you have constrictors, somewhere you have some tissues like larynx and pharynx over here. So floor may be somewhat different. Contents also different. That is why we have divided the triangles. This is what you need to know. But remember that if you know the diagram, most things will be taken care of. Now comes the infrared muscles. Now, what are infrared muscles? See, here we have discussed earlier also that we have a hyoid bone over here having a body in the lesser greater column. Below hyoid bone, what we have this Adam's apple, and we have this big thyroid cartilage. Below this, we have the cricoid cartilage. I told you mnemonic, remember HTC. So we have H for the hyoid bone. Now see what happens is that there are some muscles which are below the hyoid bone. So they are known as infrahyoid muscles, as common sense as that. If I ask you, okay, can you tell me that this muscle, which is anterior belly of digastric, is it infra or suprahyoid? You will say, obviously, sir, it is above the hyoid, so it is suprahyoid. You are right, it is suprahyoid. Any muscle lying above the hyoid is suprahyoid. All these muscles below the hyoid are infrahyoid muscles. So these are basically our strap muscles, mainly the muscles in the muscular triangle. Okay. Infrared muscles are a group of 4 muscles. They are all telling the number also, that are located inferior to the hyoid bone. So already they are the contents of which triangle? Muscular triangle. So hyoid and below it. So you have sternohyoid, sternothyroid, thyrohyoid, and omohyoid. All these 4 are your infrahyoid muscles as well. Now, once you know this, then you can go through this table having muscles, their origin, insertion, nerve supply. At least remember the nerve supply and their action. Sir, what about origin, insertion? Read them once. See, the trick over here is not to be intimidated by, because there's so many things. How will I cover them? Try to apply. You guys are so intelligent. You guys are brilliant doing MBBS over here. Okay, so try to have some smartness while studying also. For example, you know, okay, that digastric muscle is from, if you look at the image, you get a good bit of idea from where to where the muscle is going. Simply, you will understand origin, insertion. Therefore, anatomy, always there will be diagrams associated with the notes, else you can't understand. So you have this good, you just read them once or twice, origin, insertion, and look at the diagram, you learn. Similarly applies for the action. The last so many years I've been teaching anatomy, and the one common question which each year comes to me is that how to remember so many muscles, their actions. And I'm tired. I woke up all night, a day or two before the exams. I am reading the muscles, their action. I'm forgetting. I'm being a bit stressed and all that. I always tell them, please apply logic from the beginning, from the day one. I tell them, once you know that a particular muscle is going from point A to point B, any point A to point B, if the muscle is going, when that muscle will be stimulated by the nerve, that muscle will contract. Yes or no? Basic property of a muscle is contractility. You study in physiology. Once that muscle will contract, so A and B will come closer. Yes or no? A and B, these 2 points are coming closer. Understand the flexion of the forearm over here. So in the muscle contraction, A and B will come closer. So either the A will move towards B or B will move towards A, or in some cases, both move simultaneously. That is the action. For example, let me apply this, what I'm saying over here, to the muscle, say digastric. We know we have an anterior belly and we have a posterior belly. Anterior belly is going from mandible to hyoid. Posterior belly is going till mastoid. What will happen? Now imagine the digastric contracts. Mandible can easily move. Will it move down or will it move up? It will come down because mandible hyoid is at a lower level than the mandible. So what will happen if the digastric contracts? You can see over here, it depresses the mandible or it elevates the hyoid bone. Sometimes it might elevate the hyoid bone while swallowing. Okay, so once you open the mouth, suppose you have to eat something, you will open the mouth. These digastric, they will help in opening of mouth. Then once you swallow it, once you swallow, your hyoid is lifted up. Why? Because that's a different whole topic of the stages of swallowing, where the tongue pushes the food posteriorly. So the hyoid needs to elevate up. As I told now, that either A will move towards B or B will move towards A, or they will both move in different actions. So when I'm opening my mouth, my mandible is moving, digastric. When I'm swallowing, this muscle again acts, but this time it is moving the hyoid, not the mandible. That's the beauty of the body, right? So you can apply this basic knowledge to all the muscles and you can understand. It's not just these 4 muscles. These are your infrahead muscles. Okay. Next topic that normally comes in you as a short question or in your any of your PG entrance is the ansa cervicalis. Ansa means a loop of nerve. Cervicalis means the region of neck. Ansa means loop. So you have a loop of nerve in the neck region that is known as ansa cervicalis. This ansa cervicalis is formed by which nerves over here? It will have contribution from the 12th nerve, that is the hypoglossal, that is known as ansa hypoglossae also, and also from the upper cervical nerves, mainly our C1, C2 nerves. They also help in, or C3 also might add over here. They also from the ansa cervicalis. Let us see. Now, where is it located? In previous session, we discussed that ansa cervicalis is located where? In the anterior wall of carotid sheath. If you don't remember, then do revise and go and watch that video as well. So it is a loop. Now let us see what is written. It's a nerve loop embedded in the anterior wall of the carotid sheath over the lower part of larynx. It supplies infrahyoid muscles. So see, here is the hyoid bone. Here we have infrahyoid muscles. Here is my carotid triangle, and here I have ansa cervicalis. Ansa cervicalis is present where? In the carotid triangle. So this loop of nerve will supply infrahyoid. Now here, the only correction I want to make over here is that 4 muscles are written over here. Ansa cervicalis supplies omohyoid, sternothyroid directly. These three muscles are directly supplied by ansa cervicalis. While on the other hand, this thyroid, it is supplied by C1 separately. C1 separately will supply it not through the loop of nerve. This is a very common question asked in your PG exam. All of the muscles are supplied by ansa cervicalis except. Then that except the answer will be thyroid. It is not supplied by ansa cervicalis. It is supplied by C1 separately. That is the question. Okay, now formation. Okay, we have this hypoglossal nerve and C2, C3 nerve over here. They form it. Superior root will supply this, inferior root. Basically, OH, SH, and ST. These three muscles are supplied by ansa cervicalis. And I remembered it by using a mnemonic. Mnemonic was very straightforward. O, she is ST for stunning. Oh, she is stunning. That was the mnemonic which I used, and till now I remember after so many years. So that mnemonic worked. Tried and tested mnemonic. Okay, so you can take the help of this mnemonic also if you want. This was our ansa cervicalis. Okay. Now let's come to the another topic, that was the parotid. So this was all about the anterior triangle of the neck. I will repeat again the important points over here. Focus on this image. Before that, we discuss about this image, right? Focus on this image. Try to draw then this image as well as we tried to draw over here. Then you know the boundaries, then read these contents and all for 2-3 times, and then you're good to go. Then locate at the infrahyoid muscles. Understand where are they located, their actions, and their nerve supply also that we already seen. And finally, the ansa cervical is also important. Next, let's come to the topic of parotid region. Which topic is there? The parotid region over here. Okay, here we have the parotid region. Now, what do you need to understand parotid region as parotid gland? It is obviously quite an important topic. 2-3 things I need you guys to remember of this parotid gland or parotid region. First of all, as this region is very complicated, let me tell you, you should know the extent where this region lies, where we have the parotid gland. And once you know the extent, then you should know what are the relations of this particular organ. Why? Because a lot of surgeries are being done. So you should know which nerve and vessels are surrounding this area. Then you should know that what are the contents inside the parotid gland. You will say, sir, what do we mean by this? Gland will have what? It will have Isnay cells and will have some duct. You are right. But in this parotid gland, it is a special gland. And you might be surprised to know, if you are hearing for the first time, that this gland has nerves, big nerves, big veins, big arteries inside it. For example, external carotid artery, retromandibular vein, facial nerve. These are the contents inside the gland. So we should know about this also, the relations of this gland, and then how about the nerve supply. That tomorrow the person comes to you that, okay, sir, I don't know, my mouth is very dry. Saliva is, I don't think my body is forming saliva. Then your mind should start thinking, okay, there are 2-3 main glands, parotid gland, submandibular and all sublingual. I should check that what is happening to the glands. Is there any nerve problem that the nerve is compressed somewhere so that it is not able to innervate? So you should know the nerve supply of the gland, as simple as that, right? There are 2-3 things that you should know. So what is the extent of this region? You have the parotid gland, fine. We know the parotid duct opens in the upper second molar tooth, fine. Parotid duct over here. That is what we know basically. What are the specific surrounding structures? What is inside the parotid gland? And what are the surrounding structures or relations is what? These are only 3-4 things that you should know. In the end, obviously, we have the applied aspect. Applied aspect is so much, there are so many tumors, so many symptoms related to this part of the body. Okay. Let's start now. Let us see. So describe parotid gland. The questions will come like this. Describe under external features, structures lying in the supply applied. Okay, similar what I just told you. Because my goal over here is not just to make you good for the university exams and help you in passing with flying colors. That is not my only goal. It's one of my goals. My other goal over here is help you understand the subject anatomy, because anatomy is nothing but your human body, and you are becoming doctors of the human body. So if I may help you over with understanding the subject, that is understanding the body, so that you develop interest in the subject. That is the main point. So you will, once you develop the interest in the subject, once you are become fond of reading and understanding more and more through my classes or anywhere, your interest for the subject should develop. You will become a better doctor. And tomorrow, if you want to do PG in any subject, you should easily clear that exam also. If you are not even aiming for the PG, let me be clear over here, even then you will become a better doctor and a better human being, because that is your goal. Simple as it. Too much of knowledge here and there. Let us come to the topic. So, location lies in the pyramidal fossa posted to the ramus of mandible on the posterolateral surface of the face. Meaning by this is the ramus of mandible. So there is a pyramidal space over here. So it is located behind the ramus of mandible over here, posterior lateral part of the face. This is posterior and lateral part of the face. Now there are 5 boundaries written over here. Better see with the help of this image. Look at this image over here. Okay. I am circling number 1, number 2, number 3, number 4, number 5. This rough area is the parotid region where you are seeing this as the parotid gland over here. So it is not what you can say as a regular, having a regular structure like a rounded structure or a rectangular, nothing like that. It is a pyramidal sort of structure, bit irregular. So what are the number 1, 2, 3, 4, 5? These are the boundaries. Number 1 is what? Zygomatic arch. So this is the zygomatic arch over here. Number 2 is related to the ear. So you have external ear and anterior sternomastoid muscle. So you have ear and the sternomastoid muscle over here. Number 3 is this over here. That must be the ramus of mandible. It is ramus of mandible. Number 4 is from the angle of mandible to front here to the body. So you have angle and inferior border of the mandible. And number 5 is the anterior border of masseter. So what does it mean? This is the masseter muscle over. What is this? This is the masseter muscle involved in chewing. Masticatory muscle. So 5th is this. That is the anterior border of masseter muscle. So look at the face. Forget about the diagram is there for you to guide. Ultimately, you have to see a person. For this thing, you can see your own face. This is the zygomatic arch, number 1. Number 2 is this ear, external auditory canal, and the sternocleidomastoid over here. Right. Number 3 is the ramus of mandible. This is my mandible ramus. This is the number 3 ramus of mandible from the sternocleidomastoid. Number 4 is the angle to the inferior border. Number 4 is this. Number 5 is anterior border of masseter. So if I clench my teeth, you can see some movement over here. This is my masseter, right? This is the number 5. So this region, 1, 2, 3, 4, and 5. This is my parotid region. Where if you have been very naughty in your school time, you might have taken some slaps from your teacher or your elder brother, sister, or even from your parents, right? This is the area, right or not? Parotid region. So this is the area parotid region. That is the main point of this topic, parotid region, that the topic should be clear anatomically. Where does it lie? That is most important. Now let us see the notes over here. Anteriorly, we have this posterior. Fine. There's a term known as parotid capsule. Okay, what is this? This gland is located inside a capsule, fair enough, but understand the main part that is formed by the investing layer of deep cervical fascia, previous topic, that is forming this parotid capsule. Okay. Now, other point is, sir, what okay, fine, but it is so much theoretical. What is the use of it? Have you heard of a disease known as mumps? You must have heard. Some of you might have encountered with it also. Here, the child will complain of too much of pain over here because there is a parotid gland swelling. Once the parotid gland swells, the parotid capsule is actually stretched. When this parotid capsule is stretched, the nerve over here are also stretched. Because this parotid gland is covered by a deep fascia, so normally, this parotid gland has no area to expand because it is covered by a deep fascia. Deep fascia is inelastic. It is not elastic. In a disease, you are enlarging this gland. So it is stretching the capsule and the nerves are stretched. That gives rise to pain. This is the parotid capsule anatomy, applied anatomy. Getting a point? Next, let's see external features, basic of anatomy. So remember over here in parotid gland, we can draw it somewhat like this. Remember the apex is below, the base is lying superior. Then you have an anterior border, you have a posterior border, and medially, not out, this part is the lateral surface, superficial surface, we can say. This part of the gland, close to the skin, is superficial surface. There will be a deep surface or a medial surface inside. There is a medial border lying inside. This is the medial border as well. I'm just giving you an idea. So we have a base, we have an apex, anterior border, posterior border, superficial surface, and a medial border. That is what they're trying to show over here. This whole is the anterior border, apex is below, base is above, and behind posterior, and there's also medial border. You'll see that. Okay. Okay. So borders here, there are three borders: anterior, posterior, and a medial. You don't see it on the outside, present medially. Relations. Now come the part relations. This image over here, look at the image and think in your own mind, or you can answer in the comment box as well, that from where have we taken? What is this image? What is the view? What is the aspect of this image? Let me help over here a bit by telling you guys that this is the parotid gland over. This is the parotid gland over. Okay. This is the area for the skin over here. This is the division skin, that is the lateral part, and this is the medial part. Okay. This is the lateral medial part. They've written over here is a bit different. Yes, it is right. Lateral medial. So I also written lateral medial. M for medial, L for lateral, right? So this lateral skin part and medial. This over here, this is a transverse section. What is this transverse section of the parotid gland? This purple cross-hedged area is the parotid gland. And look over here, there are structures inside it. Can you see the structure? Red color. This is an artery. Can you see this blue color? This is a vein. And look at this also. This is a nerve. Which nerve? Facial nerve. But my point there is, as I told you, structures inside the parotid gland. This is the facial nerve. This is the vein, retromandibular vein. This is an artery, external carotid artery. See how important that is. Now look at the relations. Anatomy is very well understood by the diagram. This you can't feel much, but you know, okay, this is our parotid gland. What is lying anteriorly is this mandible and the muscles. So anterior over here, see it is written anterior. Anterior is over here. Let me change the color, and the posterior is over here. Anterior, can you see this bone? This is the mandible. Muscles over here are what? Let me use a highlighter now. Masseter on the outside, medial pterygoid on the inside. This is masseter, right? Behind we have this mastoid process. Okay, so parotid gland over here, mastoid and mandible. More medially, what we have, remember one word, at least pharynx. Pharynx lies medially. What is pharynx? Open your mouth. What you see behind is the pharynx. So this is the oropharynx. It is medial to the parotid. Simple as that. More importantly, over here, two structures, remember. What is this? This is the carotid sheath. What is this carotid sheath? So it is having internal carotid artery and internal jugular vein with some cranial nerves. We can see how close are they to the parotid gland. How close are they? Just medial to the parotid gland or between parotid gland and the pharynx, you have the whole carotid sheath. And just behind over here, you have one more group of structure that is known as styloid process. What is that? A styloid process. So 3-4 landmarks over here you need to know. You need to know 3-4 landmarks. What are those? Let me write first of all, then you can look again the diagram. Focus on the main relation, that is the mandible. Behind you have the mastoid. Outside you have the skin, but do remember that there are a lot of structures inside, that is inside the gland as well. As I showed you, nerve, artery, vein. The thing which I didn't told yet is, in inside there are also various group of lymph nodes as well. I will tell you the applied aspect also. Don't worry. Medial to it, you have what? You have the whole styloid apparatus. So many important structures. You have the whole carotid sheath having all those nerves, arteries and veins, and more medially you have the pharynx. These are surrounding structures of parotid region. Important. Now, lymph nodes. What is so important of lymph nodes, sir? There are many diseases which are only relevant or only involving the lymph nodes. Like, for example, benign tumors like lymphomas. Lymphoma, name suggests oma means tumor, lymphoma, lymph means lymph node. So in many cases, it has been seen that in lymphomas, patients suffering from lymphomas will have a swelling over here, and the patient and the doctor might be confused that is Is it a parotid gland tumor or is it something else like a lymphoma? There, the doctor and the investigation who is doing the investigations, like a pathologist or a radiologist, have to differentiate. As a doctor, you have to go for the parotid gland tumor surgery if it is a parotid gland tumor, or you have to go for a chemotherapy if it is a lymphoma, because both the diseases will have a totally different approach. If it is a lymphoma, you can't remove it surgically. It has been spread to other lymph nodes, it will come back again. And if it is a parotid gland tumor, you need to remove it surgically. You can't just give a chemotherapy for a parotid gland tumor. So you understood basic point? This is one group of relations in a transverse section that we have seen. What is that? This is a transverse section. Have this image, very important. Then there's one more image of this. These are all the relations. Now this is the table taken from the next image. This is again relations. Okay, so now you will be seeing, see the difference in anatomy. Now, if you look at this table only, okay, apex, something is written, superior, something is written. Okay, what is all this? How will I learn this? Oh no, oh no, oh no. Oh, there are so many, like say around, say 20 structures are written over here. It's obviously impossible to remember all. What you can do is look at this diagram. This is the most important diagram over here, because there are a lot of surgeries done around the face. There are a lot of deep wounds, cut wounds, doing even shaving. Blade can go inside someone, just pushing your hand and could cut any part of the face. So there are so many structures which are surrounding the parotid gland. These are all those. So again, in this diagram, let me show you posterior, anterior over here. Okay, and this outline, this red colored outline is the parotid gland. As you can easily see, this is the parotid gland over here. Apex below, this is the anterior border. Okay, behind this is the posterior border, and this is the base in the top. Look at all these structures. You need to practice this diagram if you want to score good, as simple as that. Okay, now let me help you a bit over here. If you look at the base, this is the yellow color I'm making for the base. What is coming out is basically superficial temporal vessels and auriculotemporal nerve. So, sir, how to remember it? You can feel the, forget what feel, what are their names? Superficial temporal. This is the parotid. Where is temporal region? Over here. So obviously the temporal vessels will be going towards the temporal region. Done. Same auriculotemporal nerve, temporal. Auricle is over here, temporal over here. This is the temporal region. Done. And this is the anterior border. This is the anterior border, green highlighted. The structures coming out are transverse facial artery, obviously. Then you have the, what I said, we have which nerve inside the parotid gland? We have the facial or the seventh nerve inside parotid gland. And some of you might have learned that the facial nerve gives off 5 branches. Gives off how many branches? 5 branches to the face, like the 5 fingers over here, which are your temporal, zygomatic, then what we have, buccal branch, mandibular branch, and cervical branch. 2 zebras bit my cat, something like that. The mnemonics also. Okay. You can make mnemonics also, but there are 5 branches. So these are coming from the NDA border. Let us highlight them. Temporal branch, zygomatic branch, then we have buccal branch, upper and lower, then we mandibular, and through the apex, this is the apex part is coming down as a cervical branch, coming from the front. Along with them, you also have what? These arteries, like we discussed, transfacial arteries over here, and this duct obviously going in front, this duct. Then what we left with, we are left with the apex part below. So we have cervical branch and we have this retromandibular vein, both divisions coming over here. This we have done in the face part also. Okay, when we're discussing about the facial vein, right, in the cavernous sinus, the dangerous area and all that of the face, we discussed that this anterior division mixes with the facial vein to form the common facial vein and all. Okay, if you understood this, right, finally we have the posterior border. So what is present behind? This is the our parotid region, right? This is my external auditory meter. This is auricle. What is behind? Posterior auricular. So what are these posterior auricular nerve and vessels? Common sense. So through the posterior border, we have posterior auricular nerve and vessels. Let me highlight it with, say, with different color. Let us use this color. Posterior border. Simple as. Isn't it simple? So give you a few minutes. Now, all of this is written over here. Nothing different. Nothing different. For example, let us see a few things over here. Apex having this and this, we have seen. Okay. Base was having superficial temporal vessels and auriculotemporal. Superficial surface Obviously, skin fascia, parotid fascia, all that. Now, anterior medial, posterior medial surface, what are these? In the transverse section, let me show you again. The transverse section over here. Okay. This is which surface? Red color I'm making. This is lateral surface. Okay. Now, where a different color, you guys are going to find the answer only. This is which surface? This is anterior-medial surface. Where is it written? Over here. Anterior-medial surface. Okay, and a different color last not the least. This is which surface? This is posterior-medial surface. Which surface? Posterior-medial must be written over here somewhere. Here it is written. This is a transverse section, right? Transverse section. Outside lateral surface, inside anterior medial and posterior medial. It is somewhat like this. If you look over here, it is somewhat like this. Two medial surfaces. Therefore, you have a medial border. Where is the medial border, sir? This over here. This over here. Let me put arrow over here and write with red color. This is the medial border of the parotid gland. I hope you got it. Okay, similar things are written over here. Posterior medial, you will have the mastoid areas, and anterior medial, you will have the mandibular structures. Anterior border are the structures. So two diagrams. That's it. Now, these are the three structures lying inside the parotid gland. As I told already, facial nerve, a vein, and a artery. So how to remember it? Let me tell you. Facial these are three structures lying inside the parotid gland. Facial nerve is most superficial. Let me write over. Retromandibular vein is somewhere in the middle. An artery being so important because if you cut an artery, patient might die of the exsanguinity of the blood. Artery is the deepest structure in the parotid gland. Therefore, let me tell you over here also, as the parotid gland is a simple gland having all the structures outside it, relations and fine. But inside the parotid gland also, there are so many important structures. Therefore, any surgery, if there's any surgery which is being planned for the parotid gland, you need to have a very good surgeon taking special care not to damage these structures. Because the facial nerve is damaged, person's facial movement, facial muscle will be paralyzed. If the vessels are damaged, the blood will leak out, simple as that. So you need to have this. Then we have the parotid duct, as I told already, also known as Stensel's duct. Where does it open? Simple, remember, upper second molar tooth. Upper means maxilla. That is where it opens. Do remember it. This basic thing opposite the second molar. Mouth opposite second molar, but which upper jaw? Maxillary second molar, not the mandibular, the maxillary second molar, upper jaw. Upper jaw. Do remember this, right? Then your blood supply, you can see this. These diagrams again, they are simple diagrams. You can make them out. I am focusing on the most important, so you can miss them out. External carotid artery over here. Let me use a different color, so greenish color. Okay, external carotid artery you have to make, and then you have to make some branches over here, transverse facial artery, and all. Okay. Nerve supply now. As I told, the last thing is nerve supply. Don't forget the nerve supply. Nerve supply is simple. If you look at the diagram over here, fine, but you have a preganglionic nerve. Then we have a ganglion, and then we have a postganglionic nerve. What does it mean? Let me tell you. Ganglia in the parotid gland is the otic ganglia. The preganglionic coming from the ninth cranial nerve and its branch is lesser petrosal nerve. Let me highlight over here, ninth cranial nerve, and its branch is the lesser petrosal. Which branch? Lesser petrosal. Postganglionic is your auriculotemporal nerve. As you can see over here, auriculotemporal nerve. Think about it's a branch of which nerve? It is a branch of B3, that is the mandibular division of trigeminal. The branch of mandibular division of fifth, that is the trigeminal. So remember that all the glands, mainly the secretory glands, will have two nerves. One before the ganglia, one after the ganglia. Before the ganglia will be coming from the brainstem. Here you can see they're coming from the medulla oblongata. From where they're coming? Medulla oblongata. Which nerve? Ninth. Gives off which branch? Lesser petrosal nerve over here. Now it ends in the otic ganglia. This is the otic ganglia. It will end over here. From here, the next nerve will come out, that is the auriculotemporal nerve, branch of B3. And then this is the nerve that is going to supply the parotid gland. Some of you might be thinking, then sir, what is the facial nerve doing over there? Very good question. If this question is coming to your mind, very good. Why? Because facial nerve does not supply parotid gland. Yes, you heard me right. Facial nerve, seventh nerve, it does not supply parotid. Does not supply parotid. It is inside parotid. Does not supply parotid. Neither as a preganglionic nor as a postganglion. It is supplying the facial muscles. Okay, bit surprise. Okay, here is the same thing in the form of table over here. Lymphatic is not very important, but applied anatomy again. You have the syndrome, Frey syndrome. This Frey syndrome is also known as gustatory sweating. Gustatory sweating. Now, important. It is important. Suppose there is a deep injury over here. Suppose you're practicing, say, darts or the nail hit over here. Then what happens is that auriculotemporal nerve, and if you remember the nerve supply of face, then we discussed that the entire face is supplied by trigeminal sensory nerve, except this area which is supplied by great auricular. So what is happening actually in this area? We have a nerve which is supplying the skin, where you can feel the hand. That nerve is great auricular. Okay, so we have one nerve that is the great auricular. If you remember the face topic, then if the injury is deep, then it will go deep. Is another group of nerve inside the parotid gland, as we discussed postganglionic nerve, that is auriculotemporal. This is a branch of V3. Great auricular coming from C2, C3. Fine. Now, once you remove that injury, suppose there's a nail which went inside, you remove the nail, you applied some dressing, some gave you antibiotics, tetanus injection, fine. After you remove it, there's a natural healing. In that natural healing, these two nerve fibers may grow together or they may get mixed up. Now what will happen is, auriculotemporal nerve is for salivation, and this is great auricular is on the face. This is for sweating and all. So sweating and salivation, these sensations, they mix up. So when the person sees the food and he wants to salivate, the body wants to produce saliva. While producing saliva, the person will start to produce sweat because of great auricular nerve mixing with auriculotemporal. That is known as gustatory sweating. Gustatory means salivation, sweating. So during the time of salivation, person will have increased sweating. That is known as gustatory sweating. It is also known as Frey syndrome, as written over here, and also known as auriculotemporal syndrome. Auriculotemporal, very famous question in your PG exams. Auriculotemporal syndrome, right? This one. Then I already told there can be a lot of tumors like pleomorphic adenoma. There are other tumors as well. Mumps is what I told in the beginning only when we were discussing the parotid capsule. Right, guys? So this was the parotid gland. Let me just quickly revise in less than 1 minute. Less than 1 minute. I'm not revising complete, but what I said in the beginning, what you need to understand in this complicated area is the extent. What are the structures around? And if you take a TS, what are the structures around again? Contents inside, nerve supply, and the applied part. Simple. Extent was this 5 structures. Don't forget this 5 structures. For relations with surface and borders is simple. Relations, look at this TS diagram, try to draw it, and look at this lateral view diagram, try to draw it. Relations done. Relations are done. Then talk of parotid capsule, talk of duct, obviously. Structures inside, we have seen nerve supply. This is a 10-15 marks question, a very good question. Right. So guys, this was our discussion today. I hope you liked it. Again, if you go back to this presentation over here, okay, we can see these are all the features. Don't forget to subscribe if you haven't yet subscribed. Okay. These are all the subscription models over here. That's all from my side. Thanks for watching. And for more content, follow the social media handles. Okay, you can follow the social media handles over here. These are all the social media handles, subscription plans, and all this structure. That's all from my side. See you soon. Till then, bye-bye. Take care. Any doubts, do reach out to us. We'll help you out. Thank you. Bye-bye. Take care.